There's a whole battery of tests that you can choose when evaluating athletic performance, whether it's functional mobility tests or strength tests such as the 1 rep max. Testing is really important because it tells us the abilities of our athletes. It identifies strengths and areas of improvement for us to set goals and progress to. It also tells us baseline scores, a relative measure that tells you whether the program that you've set is working or not. Now, when designing your testing battery, you want to think of 5 main points. The metabolic demands of the sport, athlete, and position. Okay, is it more a phosphagen system, anaerobic or aerobic? You want to think about the biomechanical movement patterns. Is it in the sagittal plane, transverse plane, frontal plane? You want to replicate those movements. For example, if a basketball player is wanting to be testing on his jump height, a vertical jump height test would be great. A vertical height jump test would not be great for an ice hockey player, which is moving laterally. You want to think about the experience level of the athlete. Is there a technique or skill that can be learned for this test that would improve the score, and therefore a more experienced athlete may do better? Think about the age and sex of the athletes. Some require, again, training experience, so an older and more mature athlete may perform higher. Difference between gender and therefore strength. If I asked everyone to do a pull-up, would it be able to show me differences in strength, or would everyone get the same score? If everyone gets 0 and they can't do a pull-up, that's not telling me how much stronger someone's bicep and back is because everyone got 0. So also note the appropriateness of tests. Okay, if you're doing skin folds or DEXAs on a male, it may be easier than on a female where we can't do a chest skin fold, or we can't do a DEXA without a pregnancy test. So thinking about these underlying factors that go with the test is important to make it reliable and consistent for all. The last thing you should consider is the environment that you're testing in. Now, sometimes you can control the environment, others you can't. Okay, so make note of the temperature, the humidity, the altitude. All of these things can affect the performance of an athlete in this environment. Now, if you can't control it, just making a note of it so that when you retest, you can see differences and understand why differences may be occurring. If you can control the environment, try to be as health and safety minded as possible. Keep the temperature cool, keep the humidity cool. If you go into altitude, try to acclimatize before. We know we lose oxygen percentage as we go up in altitude. Yeah, that's going to affect aerobic performance more than anaerobic. So once you've identified and evaluated the position, the sport, the athlete, and you can test those parameters, you want to do it in an order that will not cause fatigue to the next test. So you create a battery of tests in order of from non-fatiguing, such as your skin fold, your DEXA, your body composition, flexibility tests, to agility next. That would use your phosphagen energy system, quick but not very fatiguing. Next, maximum strength tests, 1 rep max, 5 rep max. Those tests would be next, still using creatine phosphate system. Then look at sprint speeds. Okay, things that take a little bit longer and a little bit more exhausting will take a little longer recovery. After that, local muscular endurance tests. Okay, the push-up test, the curl-up test. Following, anaerobic capacity tests. These are a little bit more demanding, require a lot of recovery. And finally, aerobic capacity tests like the VO2 or the 2-mile run, which will gas you quite considerably and would lead to negative performance if you were to do it in the other way around. So when you're testing, always think about how can I have my athlete succeed at best and have reliable, consistent results so that when you retest, you can see progression and hopefully that your program's working well. You want to ensure that your testing battery is valid and reliable. What does that mean? It is that, is the theory behind what you're choosing these tests for relevant? Is it valid? So if I am working with a wrestler that has to grapple, I may choose a forearm grip test, isometric grip test, to see their forearm strength. That's a valid test that is going to identify a strength or weakness in that athlete for that specific sport or position. You need to make sure that athletes are aware of what that's testing. Okay, that's face validity. That normally increases the likelihood that that athlete will perform higher. although in some cases may cause anxiety and decrease performance. So sometimes you hide what you're testing. That's often used in psychological tests where people can choose to overachieve or underachieve to have a desired result. In general, for athletics, we normally increase performance when we know what we're testing. You want to make sure that if you choose a test, that not only does it test what you're trying for it to test, that your performance would improve in that skill if the test improves in its score. So if I did a vertical jump and achieved 20 inches on my vertical jump, and after my program I achieved 25 inches on my vertical jump, that means I can jump higher and should subsequently have a increased performance in the world of basketball or high jump or volleyball that the athlete is playing in. You also want to make sure that they're discriminate, that there aren't two tests that test the same thing, otherwise what's the point in doing them? You're just going to fatigue your athlete. So when you're choosing them, make sure that they're testing separate aspects of that athletic performance and you'll be fine. So let's talk about reliability. When we're talking about reliability, there are three main areas that can create inconsistencies in testing protocols that you should look out for. Intra-subject reliability. This is all the things that can happen in day-to-day life that can affect performance when testing. This is differences in a person from Monday to Tuesday to Wednesday. Each day, there are many things that can happen outside of athletics that can impact performance. You also have intra-rater variability. The difference between me scoring you on a test on Monday versus Tuesday. Am I following the right protocol each time? Am I having the same results each time? There's also inter-rater reliability. This is if I have multiple testers, are they all under the same understanding of the procedure and the method of testing so that you can get consistent results? If I test on Monday and a colleague tests on Wednesday, are we going to see the same results, or do I do it slightly different to them and therefore inconsistencies in the results, which make it a pretty unreliable test? So that's the main things you want to think about when you're evaluating the performance of an athlete. Okay, it's baseline testing, understand strengths and weaknesses, set goals to achieve, and then you should be able to see progression. Hopefully, if your program design is good, you're going to see some changes in that athlete, and hopefully those scores on those tests should improve. And if they don't, either the test is bad, or the program's bad, or the athlete's doing something wrong. Okay, so I hope that helps, and remember to like my videos, comment, and we can have discussions in the comments below.